Go. You ready?
Yeah.
Okay, so I've went over the physician's order, which calls for an ABG, which is what I'm going to be doing today. I've also looked up the patient chart for any significant findings data in patient history and to see if the patient is on any anticoagulants, and I've also gathered any protective gear for myself. I've gathered my necessary equipment, which includes my 23 gauge syringe, my gauze, my alcohol prep pad, my specimen bag, my support for the patient's arm, and my gloves. And now I'm going to go ahead and wash my hands and introduce myself to the patient. Hi, my name is Brittany. I'm a respiratory care student. I'm here to draw some blood. Is that okay with you? Yes. Okay, may I have your name and date of birth? Perfect. Okay, so now I'm going to go ahead and palpate. Okay, and I'm going to go ahead and fill the patient's label out for their name, the time, the doctor, the patient's current FiO2, the temperature, and the room number. And now I'm going to go ahead and put my gloves on. And sorry. And I'm going to change my gloves since I would change my gloves since I just picked that up off the floor. And I would have an alcohol prep pad. And which I don't have one in that bag. So I would have an alcohol prep pad and I would clean the patient's arm. And after that, I would go ahead and take my needle. No, I'm sorry. I would do the modified Allen's test, in which I would lift the patient's arm and I would squeeze both. I would have them raise their hand, squeeze a fist, and I would squeeze both the ulnar and the radial side. Upon the release of the patient's fist, I would move the side where the ulnar artery is, and I would see if there was filling to return, pinkish, and if it was, then I know the patient has collateral circulation, which he does, so I will go ahead and put the support under the patient's wrist, and I'm gonna go ahead and get my needle ready. I would have uncapped it, and I'm gonna go ahead and go and bevel up. With my hand supporting the patient's arm, go and bevel up, palpate. I got blood. If I didn't, I would pull out just a little bit without coming out of the patient's skin and redirect just the needle, moving my arm. And now that I got the blood, I would go ahead and put the gauze on before removing the needle. I would recap my needle. Okay, apply pressure for 30 seconds and put my Band-Aid on. I would apply pressure for 10 seconds if the patient was on any anticoagulants. Then I would, twist the needle to make sure that the heparin gets mixed in with no coagulation, so it won't be any coagulation. I would take off the needle, put on my stopper. Put my specimen in the specimen bag and my needle and sharps container. Clean up my mess, make sure the patient is okay, and chart any necessary documentation. That's it.